One thing that I'd like you to talk about that you mentioned in your book that I found super interesting was the teeth clenching as a result of premature contacts. This is a term that I had never heard, and I suspect my audience is not familiar with. Can you explain it?
Yes, I was waiting for you to go into the bruxism and the pain, because I know your audience is interested in
I'm
that
telling
topic.
you have 1,000 or more people on the edge of their seat waiting to hear why they're grinding their teeth, and I've never heard this explanation from anyone else.
Well, what happens is that if our teeth are not in contact during posture and we separate them, we have micro extrusions. The teeth will move, and any dentist or anybody that has ever lost a tooth will know that if you lose a tooth, the opposing tooth will grow into that space. Mm-hmm. So teeth are erupting our whole life. We don't notice that they're erupting because they have partners and they continue to erupt, and they go forward. If we keep our teeth apart, even a little bit, for long periods of rest, then some of these teeth will erupt, and they're not going to erupt at the same rate. So some will erupt, and then when we bite down, there will be that tooth that hits a tiny bit early, and we won't know that, we won't recognize it, but our brain will, and it will grind it down so that all the teeth now are touching together, and we will continue doing that. That's only part of grinding. That's physiological grinding, and it wouldn't be a problem. But then we have issues with, when you hang your mouth open, things start falling down, and that creates less space for your tongue, less space for the airway, and your brain wants more space. So grinding is almost always related to a poor airway. And everybody that grinds is trying to open the airway, especially children. A lot of children grind, and they grind a lot, and they're trying to open their airway. Because when we close our teeth, our tongue gets trapped, and it has to sleep in the back of the tongue. So we have to open our mouth to allow the tongue to spill over the teeth. Mm-hmm. And when we close again, we get those premature contacts, because the airway is, if we close the teeth and keep them the way we have to, the tongue cannot hold it. So if you have somebody that doesn't have a good jaw, and you ask them to keep the teeth in contact for a long period, they won't be able to, because then the tongue has to be in the back of the throat. So when we take pictures in orthodontics, sometimes we take the side view. And on children, I remember before I knew all this stuff, we knew we had to click really fast. We said, okay, well, I'm going to say 1, 2, 3, put your teeth together and click. Because if you don't do it fast, the kid would open the mouth, and you always get the picture of a little bit open of the teeth. So we know that you can't keep your teeth in contact if you have an airway issue. And it's kind of a vicious circle, or a chicken and egg thing, because you will have the teeth apart will cause less room to breathe, and putting them together will keep you from being able to breathe. So you have to separate the teeth. And we've actually looked at this with an endoscope, where we look at the pharynx, and when teeth are together, the pharynx gets closed, and then you ask the patient to swallow, and then the pharynx opens, and you can see it with an endoscope.
Wow.
So we've actually looked into this stuff. And then that also relates to joint pain.
When the teeth are closed, it opens the airway.
No, when the teeth are closed, if you don't have enough room and you try to close your teeth, it will close the airway. Because imagine you have, a big Jack in the Box or something inside the mouth. If you close it, the extra part will live in the back. If you split the teeth, the extra part will be in the front, so your airway will be open.
So this is all based on a jaw that doesn't have enough space.
Yes.
Okay.
If you keep your teeth together since you're a baby, since the teeth erupt at a year old, and your teeth are together lightly in the tropic premise, which is described by John Mew, and you have that position for at least 4 to 8 hours a day, then your teeth together will continue to expand your jaw, and the tongue will put that light force so that your jaw continues going forward. If you keep your teeth apart, for whatever reason, there's tons of reasons to keep the teeth apart. It could be that you're not breathing well, which is the most common reason, or it could be that you have a cavity and it hurts to put them together. So you start hanging your mouth, and you can have a mouth open with lips together. So if your teeth are apart, that technically your mouth is open, even if your lips are together. So if that's the case, then you will develop in that way as you're growing. And there's a drawing in JAWS in the book, which is very interesting, because if you at rest your teeth are apart, then your joint will be comfortable in that position. And so every time you close, when you're fully developed, you will be pinching the meniscus of your jaw. So the way to treat people with jaw pain is to give them something, either enlarge their teeth, make them longer, or give them a splint that actually opens the vertical dimension. And that will help them with pain because they will not be pinching it. And that's why the treatment is to enlarge, make the teeth longer, or the splint. So if you have a good position when you're little and your joint develops in a good position, then you can keep your teeth closed without any pain. However, if that falls apart and it's not right, you'll either grind down to try to find that position, or you will just stay with your mouth open, or both, and you will have pain. Every time you chew, you will be hurting your jaw.
If you enjoyed that short clip and you want to do a deep dive into teeth, jaws, and breathing related issues, you've got to see the full interview with Dr. Sandra Kahn. You can access that by clicking the link in the upper right hand corner of your screen. I'll also put a link for it down in the description. Thanks so much for watching, and I'll see you next time.